Hi everyone, Dr. Joy Void-Holmes here, and I am proud to introduce my latest creation with Nordent called the CoCo Kit. The CoCo Kit was inspired with my special bond with my grandson. When I deliver my courses, I always say that the instruments that we use are not like our grandmother's instruments. And because I am a grandmother and he affectionately calls me CoCo, we have the CoCo Kit. So I put great thought into selecting this kit. Ideally, you want to select a kit with fewer instruments so that you can have more setups throughout the day. At a minimum, what you can have, whether you're a novice clinician or someone who is very experienced that's used to working with a multitude of instruments, you need to have a sickle scaler. It can be an anterior and a posterior or just simply one universal scaler. You need to have an area specific or maybe two, and then you need to have a universal scaler. So let's go through the kit. You need a mirror. Everyone needs a mirror. You have to be able to see. So I've selected a double-sided mirror. We do know that you can see everything with a double-sided mirror. So at the very least, you need a mirror, and these would be considered your diagnostic instruments. In addition to that, of course, you need a probe. I advocate for an Explore probe combo. I like the UNC probe so that you can actually count in increments instead of guessing where the pocket ends. Last but not least, for my diagnostic instruments, I have selected an 1112 Explorer. This is an extended Explorer. So for those of you who are seeing patients that have deeper pockets, this has an extended shank that allows you to reach the base of the pocket. The next scaler I want to introduce is the M23. So this is a universal sickle scaler, and here it is. Why have I chosen this one? This is very versatile. It can be used anterior, posterior, super, and sub. Now, I want to caveat when I say subgingival. When I mean subgingival, I'm talking about a portion of the anatomical crown that may be below the gingival margin. So as you can see, this is ideal to fit around big bulky molars, but you can also adjust it to fit on those smaller anterior teeth. The universal that I have chosen for this kit is one that everybody loves. Most people use it, and it would be the Barnhart. This is a good solid instrument. This has a nice sturdy shank on it, so it really can be used for patients who have moderate deposits. Again, with a universal scaler, two cutting edges, so you can use it all around the mouth. You can use it anterior and posterior, and because it has a rounded toe, it is safe to be used supra and subgingival. Rounding out the CoCo Kit would be my area specifics. So the first area specific I have chosen is the Gracie 7-8. Now you're probably thinking, why would she choose the 7-8? I've chosen the 7-8 because it's extremely versatile. If you know what you're doing, if you know how to incorporate advanced seating positions, advanced fulcrums, you know how to adjust your body, and you understand instrument design and function, you actually can use most Gracies outside of their traditional use. So with the 7-8, while it was traditionally designed to be used on facial and lingual surfaces for premolar teeth, you actually can use this instrument effectively on mesial, distal, facial, lingual surfaces, supra, subgingival, anterior, and posterior. Last but not least, one of my other favorite instruments is the Gracie 1314. I love the Gracie 1314 because, like the 7-8, it's a very versatile instrument. For the CoCo Kit, however, I would recommend this instrument for the distal surfaces. So it can, again, be used anterior, somewhat, but mainly posterior, but supra and subgingival. Now you may be thinking, why in the world does she love the Gracie 1314? Well, as a temp, I would go into offices and I would always be in search of sharp instruments, and lo and behold, this was the only sharp instrument in the kit. So I had to learn how to use it like it was my magic wand. This is a very, very great instrument. So for the CoCo Kit, what I do want to mention, this kit is really designed for those patients that you would see for their routine recare appointments. So those patients that are coming to you every 3 to 4 months, or your perio maintenance patients. This is not a set that is going to be able to treat everyone in your practice. If you are doing a lot of scaling and root planings, you need kits outside of this because you need additional instruments for that. In addition to this, sometimes you get patients that have very specific needs. So I would highly recommend for you to select ancillary instruments that you need to pull out for those cases. This concludes my introduction to the CoCo Kit.